All right, you're still here with us on the AM show. Let's talk some coronavirus conversation now, coming on the back of that press briefing yesterday. And the Ghana Health Service Director told us quite a bit. Let's touch base with Dr. Michael Owusu of the KCCR. Let's have the conversation. He's joining us. Good morning to you, Doc. Good to see you. Thank you for your time. Hello, Doc.
Doc, you can unmute, I think.
All right, apologies, but Doc, let's see if we can get the sound now. Good morning to you again. There seemed to be some challenge with that. We're going to work on that and then raise him back. But Roland, there were quite a number of things that we were told in this latest update. The Ghana Health Service, for instance, says that the COVID-19 situation in Ghana, 26 persons are in severe conditions, while 8 others are in critical condition. Again, 4 persons who have tested positive for the virus are on ventilators. The total number of tests conducted so far is 353,752, comprising 129,462 and 224,290 tests conducted through routine surveillance and contact tracing, respectively. There's a clarification with the contact tracing that we have to also run by Dr. Michael Owusu if we get that connection with the sound clear. But one of the things we'll be talking about is the backlog, 23,000 backlog of COVID-19 samples yet to be tested. Some of us took a test like 3 weeks ago, 4 weeks ago, and we haven't seen the results. But of course, now we're told that if it's been that long, then you may have even recovered if you have
Definitely.
COVID-19.
And that was the main focus of the interaction on Wednesday or on Tuesday, so to speak, because the Ghana Health Service wants to have a certain posture towards the way they communicate. And it was indicated that apparently we only had 18% of the cases active up to date that we've reported. And they also wanted to communicate, especially the Minister for Information, that when we keep reporting the larger numbers, up-to-date cases, you know, we tend to use that phrase, up-to-date cases, 28,000 up-to-date cases. But beyond... I thought
we talk more of active cases than the total case counts.
No, it's these days that we're trying to. But even at that press conference on Tuesday, there was breaking news. So they wanted to put it on a site for one of the stations. It was... We have recorded 500 and something number of new cases, and it brings Ghana's total case count to this 28,000. But the reality is that we only have in excess some 3,000 active cases. And if you have to postulate all that in a great context, it will mean that we only have 18% active cases, so to speak. And it has to be put into that perspective.
All right, great. Let's touch base again with Dr. Michael Owusu of the KCCR, who's joining us. Hopefully, we have a great connection now. Good morning to you, Doc. Apologies with the back and forth.
Yeah, good morning.
Good. So this backlog, I want us to start on that note. Maybe check with Kumasi how KCCR is doing. Do you also have issues with backlog?
Yeah, so good morning to all your viewers. I think it was announced somewhere last week when we had difficulties in getting reagents about backlogs, both in KCCR and Lukuchi. But as at last weekend, we had quite a number of reagents coming in. So we are almost through with our backlogs. We've almost cleared all the things we have. Actually, they were not really backlogs, but as you process the samples, new samples keep coming. And then you keep attending to this. So as I speak to you now, we are through. We don't have any samples sitting in our freezers. All our samples are processed. And as and when we get samples, we are able to deliver results in short turnaround
time. That we worry about and we've discussed on this show, just as ordinary persons, you are the expert, help us. If I did the test 3 weeks ago and I still don't have my results, and I'm being told now that, oh, I may have even recovered, but I also do know that it takes much longer for some persons to recover, because even after the 14 days, they still have some symptoms. How am I supposed to take in that piece of news?
Yeah, so that is a challenge. And I think that is a challenge because of constraints in getting logistics and testing and delivering results in short turnaround time. If you remember, when this whole COVID started somewhere early in March, we had such huge capacity to test many samples and deliver results in the short turnaround time. But then as the prevalence, from that time went up and up till now, and the need and the demand for testing also seem to have increased across the different regions. The testing capacity, in a way, has become a challenge. So this is what created that scenario where people will submit themselves for testing, yet still it will take sometimes a week, 2, or even 3 weeks for them to get their results, which is no fault of theirs, but it's because of the constraint in getting access to reagents. So when this happens, of course, what we always advise is that when you present yourself with signs and symptoms of COVID and your sample is collected, you have to go into self-quarantine if you don't know your results, or if you feel your symptoms can be fully explained by COVID, then you have to go into self-isolation, and then you wait for more than 14 days or maybe 14 days or more until you get your results. And that helps you in a way, so you don't transmit the virus to your other neighbors or your other colleagues. And you can also begin some treatment whilst you await the results. Yeah. I think this is not consistent. This happened just because of the difficulties that we had. But once the reagents are in, I'm sure that many people will now get access to their results quickly and be able to manage, the doctors will be able to manage them.
I need your thoughts on this, but I have to first quote the Director General of the Ghana Health Service, Dr. Patrick Kuma-Boaje, and here's the quote. In order not to perpetuate backlogs, we're currently going to focus on symptomatic cases, those who come in sick and those whose cases are suspected to be COVID-19, and give them priority in terms of the testing on quotes. What are your thoughts on what I've quoted?
Yeah, so I think this is quite an important statement that because of the situation we find ourselves. I mean, you agree with me that in Ghana, we do not manufacture reagents in terms of PCR kits. We don't have upper hand in this. We all import from Europe and from Asia and from the Americas. So if you don't have control over something, then you have to find and devise ways of managing these and ensure that you do it successfully so that you don't put your population so much at risk.
But this will also have implications, wouldn't it?
Yeah, but see, this is not just peculiar to Ghana. But if you have followed through the African CDC recommendations for phases of the different, for phases that countries go through, at phase 0, at phase 1, when the virus first entered the country, the goal was to test as many people as possible, remove them from the population, and slow down transmission rates so that you can delay your peak points. And we have done that. Ghana has done a number of tests at the earlier stages, over 100,000 of tests, which enable us to remove many people, isolate them, quarantine them, and delay the epidemic point or the peak point up till now. At this stage, we are gradually going through the acceleration phase. I mean, for us in KCCR, if I give you the picture, I mean, earlier somewhere in March, you could have about 2 out of 100 samples testing positive. Then in April, you have about 5 to 10 out of about 100. And somewhere in May, we went up to about 20 out of 100. As I speak to you now, close to 70 out of every 100 samples are positive, I mean, for those that come to us. So the question now is that if you have sick people who go to the health facilities and need emergency tests for doctors to manage them, and you have voluntary people who are not sick, workers who want to just go and get themselves tested, which one will be your priority? If you channel your resources to voluntary testing and mass testing of people who are not sick and are healthy, and then you run out of resources and people who are critically ill are admitted to the facilities, they are going to lose their lives.
Just because of time, apologies. Would you say contact tracing is still useful at this point, since we're recording that many cases?
Contact tracing, I think, is a challenge because especially in Kumasi and Accra, which are considered the high endemic regions, because now for every 100 people you take, I bet you about 30 to 40 of them will have the virus. So they will have the virus not because they have been infected by the first positive case, but they have the virus because of interactions that they might have got from elsewhere. So if you are in the high peak point, I mean, the African CDC, their criteria said that if you are in the fourth phase of this epidemic, you even have to halt contact tracing because everybody you see and test will become positive. So your best bet is to channel resources to the health sector, manage those who are sick, attend to those who need critical illness, test your healthcare workers, and ensure that reduce transmission.
So essentially, contact tracing at this point is not useful.
Well, it's not as if it is not useful, but there are peculiar situations where it becomes useful. For instance, if you have vulnerable populations, old people, or maybe people who have underlying conditions, sick in home with somebody who has become positive. If you don't do contact tracing and they get it, they will fall sick. So there are peculiar situations where you need contact tracing to be done. But like the earlier phase where you can go mass and say you are testing large populations because many of them have become exposed or contact, looking at the phase where we are, that rule will become a bit of a challenge. But when you have peculiar situations, those who are vulnerable, those who are sick, those who are asthmatic, those who you know that when they are exposed, they can easily get a severe form of the disease. Those people, I think it's important to do active contact tracing and then you help them.
We appreciate your time today, Dr. Michael O. So we'll come back to you again. There's an Africa conversation. The fears that this could spread rapidly in Africa going forward. We'll have that conversation with you in the coming days. But we appreciate your time this morning. That's a virologist with the KCCR, Dr. Michael O. So stay with us. Before we wrap up, of course, we have to talk show business. Kadi is up next.